A very good day to Madam Raihan. My name is Vanessa Vincent and we are from Group 2. And the topic that we were assigned to is behavior therapy. So Sharena and I will be presenting on the history of behavior therapy. So I'll begin by explaining very briefly on what is behavior therapy. So behavior therapy is a key component of contemporary psychological care. And this therapy has actually a very complicated and a lengthy past. And its evolution has spanned more than a century, during which time numerous psychological pioneers have made their substantial contributions to this therapy. So let's move on to the origins of behaviorism. So behavior therapy is actually a school of thought which stresses on the observable behavior as the primary subject of psychological study. And behaviorism has emerged in the early 20th century, and there are two influential individuals, and they are John B. Watson and Ivan Pavlov. They have actually established the foundation for our knowledge and how behaviors are learned and shaped by their surroundings. As for Ivan Pavlov, he has discovered the classical conditioning as he was conducting experiments with dogs in the 1890s century. And from this, he had provided the foundational principles for behavior therapy. And then we have John B. Watson, where he stated that behaviors can be shaped through environmental stimuli rather than internal mental processes, which this has actually further solidified the behavior's perspective and its implication for therapeutic interventions. And we move on to the rise of behavior therapy. And this happened in the 20th century where behavior therapy started to get more formally recognized. Behavior therapy approaches gained popularity and were developed by psychologists like B.F. Skinner and Joseph Wolpe. So in 1958, Joseph Wolpe had presented a technique for treating anxiety disorders and phobias that involves progressively exposing patients to frightening stimuli while encouraging calm. So this is actually called desensitization. And this method was founded on the ideas of classical conditioning by Ivan Pavlov, and this had showed how successful behavior therapy is at reducing psychological discomfort. And then in the mid-20th, behavior therapy's use was greatly enhanced by B.F. Skinner on his work on operant conditioning. His studies focused on how rewards and penalties might influence behavior, which then sparked the creation of strategies like behavior modification programs and so on. Now I'll pass the time to Sharina to continue a little bit more about the origin of behavior therapy. Thank you.
Assalamualaikum and very good evening to Madam Nuraihan. My name is Nur Sharina binti Tai Hussein. So today I will be presenting about the integration with cognitive approach. So in this approach, cognitive behavioral therapy, which is CBT, integrates cognitive principles with behavior therapy techniques to treat psychological disorders by addressing that dysfunctional thought pattern and belief. CBT helps individuals to develop a more adaptive cognitive process, leading to improvements in emotional well-being and behavior. So moving on to contemporary applications and future directions. So from this, we can know that DBT, which is dialectical behavior therapy, which is a type of cognitive behavioral therapy originally developed to treat borderline personality disorder, which is BPD. It combines techniques for emotion regulations, distress tolerance, mindfulness, and interpersonal effectiveness to help individuals manage intense emotions and improve relationships. So for the ACT, which is acceptance and commitment therapy, is a form psychotherapy that helps individuals accept their thoughts and feelings rather than trying to change or eliminate them. It emphasizes mindfulness, acceptance, and commitment of two values based actions to improve psychological flexibility and well-being. So, in both ACT and DBT, offer effective strategy for manage emotions, improving relationships, and promoting psychological well-being with ongoing developments and aim at enhancing their accessibility, effectiveness, and adaptability across different populations and settings. So that's all from me. Thank you.
And my part is about theoretical assumption. Okay, theoretical assumption is about behaviorist theory. A psychological perspective focus on observable behavior and their content responding to structuralism and functionalism. Theoretical assumptions form the foundation of this theory, providing a theoretical framework. Behavior theory asserts that behavior can be objectively studied by focusing on observable behavior, allowing for an understanding of it independently of internal mental state like thought and emotions. The fundamental tenet of behavior like B.F. Skinner and even Pavlov, who introduced classical and operant conditioning principle, influence the fundamental tenet of behavioral therapy, which suggests human conduct is primarily learned through environmental interactions. The foundation of behavioral therapy posits that maladaptive behaviors like drug abuse, anxiety, or phobias are learned and maintained through reinforcement mechanisms, including positive, negative, or self-reinforcement.
Ms. Gayatri Rajagopal, my part of this assignment is theoretical assumption. Unlike some other therapeutic modalities that investigate conscious process or internal conflicts, behavioral therapy focuses on observable acts and the contextual variables that influence them. It is visible for behavior to change in concrete, measurable ways as a result of this attention. A crucial element of behavioral therapy, which typically involves a cooperative partnership between the therapist and the patient, is setting specific, measurable treatment goals. These goals usually include changing certain behaviors or picking up new coping skills. Teaching clients useful skills and problem-solving techniques to address their difficulties is a common focus of behavioral therapy. This may entail picking up new coping mechanisms, communication approaches, breathing exercises or trigger and craving management tactics. Since every person is different, behavioral therapy acknowledges that treatment plans should be tailored to the needs, interests, and situations of each individual client. The ability to choose interpose that are most likely to work for a certain person is made possible by this personalized approach. Normally, behavioral therapy's theoretical support highlights its practical, action-based approach to treating psychological issues by bringing noticeable behavior, procedures of learning, and achievable change management techniques.
Good day, madam. I'm Sivashankari Ramalingam. I'll be explaining on the technique used in behavior therapy. So the technique used in behavior therapy are based on theories of classical conditioning and operant conditioning. I would like to give a quick explanation about these two theories so that the audience can get a clear picture when we go deeper. As you can see, I've attached two pictures in the slide. The first picture is Ivan Pavlov, the founder of classical conditioning, and the second picture is B.F. Skinner, the founder of operant conditioning. So, classical conditioning involves the acquisition of automatic acquired reaction, whereas operant conditioning involves learning a behavior through the consequences of that activity, which then influences future behavior, such as positive and negative reinforcement. Moving on to the next slide. There are three primary techniques are categorized under classical conditioning theory. The first one is aversion theory, the second one is flirting, the third one is systematic desensitization. The first technique that we are going to look into is aversion therapy. It is a type of behavior therapy where an unwanted behavior is associated with the negative stimulus in order to decrease the occurrence of the behavior. There are three sub-techniques that comes under aversion therapy. First one is medication-based aversion therapy. Second one is sensory aversion therapy. Third one is electrical aversion therapy. So medication-based aversion therapy is when certain medication are sometimes used as aversive stimuli in the treatment of addiction. Antabis, for example, is a medication that causes nausea and vomiting if a person drinks alcohol after taking it. Next is sensory aversion therapy. This relies on comfortable sensation such as disgusting taste or smell as an aversive experience. The last one is electrical aversion therapy. So yeah, this approach involves applying painful electrical shock as an aversive stimulus. But this type of aversion therapy is considered controversial and is rarely used. Following is flirting. Flirting treatment is a highly concentrated and rapid version of exposure treatment that is employed to address anxiety disorder, phobia, and OCD. For an example, putting someone with claustrophobia in a cramped room for 2 hours maybe, so that they can overcome their fear. Next is systematic desensitization. This method was established by Joseph Wolf. The approach that I explained before, which was floating, is very similar to this one, which is systematic desensitization. However, there are differences between both the technique. Systematic desensitization is a technique that gradually exposing oneself to the fear thing, whereas flirting is immediate and thorough exposure to the object. For example, if a client is scared to visit a store, large stores, right? She may feel the least comfortable upon entering the store, but her anxiety will most likely build as she walks further from the exit door. And being in the checkout line prompts the client's highest fear reaction. In this case, she would begin by focusing on the activity that generates the least amount of anxiety and move forward from there. So the outcome is that the client gradually and systematically becomes desensitized to shopping in the largest stores. Thank you. That's all from.
Hi everyone, my name is Nur Shafiqah binti Nur Zaidi. So now I'll be explaining a bit about operant conditioning. So what is operant conditioning? So operant conditioning is actually a technique or strategies that is used in behavioral therapy to help people change their behavior. So unlike classical conditioning, which focuses on association between stimuli, operant conditioning looks at how consequences affect our action. So in operant conditioning, behaviors are shaped by their consequences. We use two main tools, which is reinforcement and also punishment. So reinforcement is like a reward where it makes a behavior more likely to happen again, while punishment, on the other hand, is like a consequences that makes a behavior less likely to happen again. So there are a lot of strategies that we use in operant conditioning, and one of it is in contingency management. So contingency management is like making a deal between the therapist and also the client, where they set the goal and decide what happens if the goals are not reached or not. So for example, if someone finish their task on time, they will be getting a reward, while if they don't, there will be a consequences. So let me give one situation to make it clear. So let's say if someone is struggling with a weight loss program. So a person struggling with weight loss sets a goal to exercise for at least 30 minutes 5 times a week and to follow a healthy eating plan. So if they achieve this goal, they reward themselves with a movie night or a small treat. However, if they fail to meet their exercise and diet targets, they might impose consequences such as skipping dessert or delaying a planning outing. So I think that's all for operant conditioner. That's all for me. Thank you.
Hello, Madam Nuraihan. My name is Monica Servalan, and I'll be presenting about the first 3 points of criticism for behavioral therapy. So the first one is reductionism. Reductionism is basically oversimplifying a client's behavior, characteristic, attitude, or their personality. So basically, the second point is may change behavior but not feelings. So what they mean over here is that usually in a therapy, the therapists concentrate or focus on changing the client's behavior instead of their feelings. According to the critics, in order to change behavior, the therapy must change feelings first before the behavior. But according to therapists, they does not work through the feelings. They does not care about the client's um, complex emotion, their unstable emotion, conflicts or dilemmas. So this will lead to the neglect. This will lead to the neglection of the role of client's internal thoughts. So with this, the therapist will fail to produce a holistic client at the end of the therapy. So this is what it means by reductionism or holism. Moving on to the next point, which is determinism of free will. So determinism in this behavioral therapy is meant that behavior is the result of certain events, which means that clients do not have a clear or free will to subject, does not have a free will to act according to their behavior, which means that these criticism only emphasize on the role of environmental factors such as their genetics, their upbringings, their social surroundings, such as parents. So, for example, an individual has no personal or moral responsibility for their own behavior, which will lead to their blame culture. So, for instance, during a therapy session, a client may display aggressive behavior, but eventually the client will blame the surroundings, such as aggressive parents or being positively reinforced for the aggressive behavior. So, this will actually does not give a free will for the clients to act according to their behavior. Okay, moving on to the next slide. And the third point is the manipulation by therapists. So behavioral therapy, basically, during the behavioral therapy, the therapists usually manipulate the clients by exerting control using reinforcement over the clients. So the therapists usually heavily rely on their authority by influencing over the clients. Like I mentioned before, using the reinforcements, like punishments or positive reinforcements. So these will eventually lead to loss of decision-making powers for the clients. So basically, the therapy will usually make the decision for the clients. So what I'm trying to tell you here is that therapy is basically the therapist is having a power relationship with the clients. However, studies done by Corey in 2009 says that there is no issues of controlling or manipulation associated with behavioral strategy. This means that behavior therapy does not embrace any goals or nor does have any agenda for changing the society or the clients. Surely, in all therapeutic approaches, there is control by therapists who hopes to change the client's behavior in a good way. But it does not mean that the therapist is actually the clients are actually at the mercy of the therapist. Yeah, that is all from me. Thank you.
Hi, madam. Thank you for giving me this opportunity to present my part. My part is about criticism, and the first point of the criticism is culture insensitivity. Culture insensitivity theories may not adequately address culture difference. Some theories may impose Western ideas onto clients from diverse cultural background. And the second point point is overemphasis on pathology. Some theories focus too much on diagnosing and treating mental illness, neglecting the importance of promoting mental wellness. And also, clients may feel stigmatized and labeled by the focus on pathology. And the third point is lack of individualization. Lack of individualization is one-size-fits-all approaches may not suit every client's unique need and circumstance. Theories may overlook the importance of tailoring intervention to the individual client. The last point is limited focus on strength. Limited focus on strength. Some theories may place more emphasis on addressing weakness and problem rather than identify and utilizing client strengths. This can may lead to a deficit-based view of clients rather than a strength-based approach. Thank you. That's all from me.
Hi, my name is Vashni. My part is about conclusion of behavior therapy. Behavior therapy is a true and individualized method of helping children with special needs improve their social and behavior skills. Behavior therapies enable children to reach their full potential and take an active role in their community by working with families and using specific intervention techniques.